Hello, I'm Olivia Ziegler, Chief Assessment Officer. Today, I want to talk to you about summative assessments in PA education. Summative assessment is used to evaluate a student at the end of a unit, course, or program to make determinations, usually against a standard or benchmark. This is in contrast to formative assessment, which is used to provide a student feedback and facilitate learning. Summative assessment near the end of a student's education is critical for program faculty to determine a student's readiness for graduation. It helps show if a student has the knowledge, skills, and professionalism to be qualified and competent for graduation. The assessment should directly connect to a program's stated mission and goals. Through a variety of assessments like multiple choice exams, objective structured clinical exams, or OSCEs, essays, projects, and oral presentations, programs can demonstrate that a student meets each of the program's stated learning outcomes. One type of assessment used in summative evaluation, particularly at the end of a program, is a knowledge assessment, typically accomplished through an objective multiple choice exam. The PAEA end of curriculum exam assesses a student's general medical knowledge as one component of their readiness for graduation. It's a 300-question, multiple-choice, nationally standardized exam that may only be administered in the last 4 months of the program. And, like other PAEA exams, the end-of-curriculum exam is written by trained PA educators from across the country who are dedicated to the development of high-quality exams. And it's constructed by experts in exam development. The end-of-curriculum exam is built with a multi-dimensional blueprint, including traditional content and task areas, which align with other PAEA assessment exams. Task areas are mapped to the PAEA Proposed Entrustable Professional Activities, or EPAs. These 3 blueprint areas, combined with the defined objectives by task area, can assist faculty in aligning the exam content with their specific program outcomes. Several other cross-cutting criteria guide the development of the end-of-curriculum exam. The goal of including these criteria is to, as best as possible, ensure that the exam evaluates a wide breadth of dimensions critical to ensuring readiness for graduation. These cross-cutting criteria ensure that subject matter experts are writing the exam to expressly consider the broad diversity of patients PAs are called upon to treat, focusing on patient care setting, lifespan, and employing 3 Bloom's taxonomy levels to assist in demonstrating student mastery of the content. Now, program faculty can use information provided to easily connect program outcomes, goals, and mission to the end-of-curriculum exam's core task and objectives. One great way to accomplish this is to use the program's curriculum committee or time during a faculty meeting or retreat to develop a specific map which shows the program outcomes, goals, and mission, and draws a direct connection to objectives, content areas, and other aspects of the end-of-curriculum exam. Other parts of the program's summative evaluation, for example, program-developed OSCEs, should also be added to the map to demonstrate student evaluation related to program outcomes. Let's talk about scoring. The end-of-curriculum exam uses policy-level descriptors to indicate whether the student has limited, satisfactory, or advanced medical knowledge. The determination of these categorical scores, or the scores that fit into each level, is made through a standard setting process, conducted by a diverse group of PA educators and subject matter experts. Every student receives a scale score and a graphical representation of their score compared to the national average. Feedback will also be provided by content and task areas with national comparison, as well as by EPA, setting, life course, and Bloom's taxonomy level. This is a summative assessment, so keyword feedback is not provided. All of this information will also be included in the program's composite and cohort performance reports, which will also include cohort means. This information helps faculty compare students to a national standard and can be considered in coordination with other components of the summative evaluation. Program faculty can decide the weight of the assessment that is most appropriate for their program. Your program's summative evaluation is a critical component of PA education. By setting a national standard for medical knowledge, the end-of-curriculum exam allows faculty members to focus on assessing other outcomes that are important to your program. We encourage faculty to have conversations about the use of the end-of-curriculum exam in your program, particularly the connection to program outcomes. For more information on the end-of-curriculum exam and to discuss how it can fit into your summative evaluation, please contact us at exams@paeaonline.org or visit endofcurriculum.org. Thank you.